this, Dr. William Hazeltine. He is an infectious disease expert. It's great to see you. We have so much to talk about. And obviously, when the UK approved this vaccine, the first thing people here were asking, well, is when is it going to happen here? We know the head of the FDA was called to the White House to be asked that very question. What does this mean for approval here? And should we read anything into the fact that the UK has approved it before the US, Doctor?
I think it will be approved relatively soon, whether it's a matter of a few days or weeks. I think by Christmas time, and certainly probably before that, it will be approved. I think the UK has taken a bold step, and I think we will follow.
Safety first, obviously, always, and you have stressed the importance of disclosing the full data from the vaccine trials before any vaccine is made available to the public. Talk about the argument. Why is this so crucial?
Well, we're giving this vaccine to people who are healthy. That's very different from giving drugs to people who need to be cured from a disease. When you're giving drugs to healthy people, you have to be sure it's safe because you do not want to do any harm. One of the things that I'm concerned about is for none of the vaccines, whether it's the Chinese vaccines, it's already been given to hundreds of thousands of people, or the Russian vaccines, or these vaccines, we don't have the data. I haven't seen the data, and I don't think anyone outside of the company and the regulatory agencies has seen the data. So we really don't know how well these work, what the safety profiles are, and what the side effects are. That's very concerning, and I hope that is remedied as soon as possible. I see no reason why, if a vaccine is going to be used, we don't have the information. We must have that information. Doctors and people who are taking it.
And typically, Doctor, would we have that?
We generally do have that. Take a look at any insert of any medicine you take. It comes with a long piece of paper you should never read. Well, that has the information you should read.
True.
Because it is the information that tells you about its safety and its dangers. And we don't have that for this. We have none of that information. It's really surprising.
It's one thing to get a vaccine and get its approval. It's another thing to get people in to actually get vaccinated. Polls show significant numbers of Americans expressing hesitation or outright opposition to getting this vaccine, particularly people of color. I want to play for you what Dr. Bernard Ashby said last night on the readout.
Maybe about 80% of the folks that I know, educated or not, they're not going to take the vaccine, or at least they're going to wait until folks get the vaccine to see how it reacts. And then make the decision after that. And, the statistics out there estimate, at least the latest Harris poll indicate that about 43% of folks of African-American descent say that they will get this vaccine.
Yeah.
But I think that's an underestimate.
So what do you say to people, Doctor, who aren't convinced the vaccine will be safe? And how much of an impediment is this going to be to getting COVID-19 under control?
I think there's two things we have to think about here. One is a general resistance to all vaccines. That isn't rational. We know that vaccines are maybe the best means we have to protect ourselves from infectious disease, the most effective and generally very, very safe. That's one. There's another group of people that are concerned about not having the information for these vaccines. That can be remedied by giving us that information. So there are two different kinds of opposition. One is easy to overcome. The other takes a lot of persuasion, and we have to work with community leaders, religious leaders in local communities, not even at the national level. This has to be done on the ground. A lot of experience shows that you can change people's attitudes and beliefs. It's really a matter of belief. It's not a matter of fact. And to change belief, you need trust.
So you also point out that even if vaccines are approved and even if that trust is gained, it's going to be months before they're available for everyone. And there are going to be more new infections and deaths without some aggressive action. Between now and when there really is wide availability of this vaccine across all demographics, all age groups, what kind of action needs to be taken in the interim?
Well, we know how to control this pandemic without a vaccine, without a drug, through public health measures. A number of countries have done it well. Most recently, France just dropped its infection rate by tenfold by strict public health measures. Without a vaccine, without a drug, it can be done. There is tremendous resistance in this country to do it. Let me just cite what's happening in Florida. There, it seems very clear that the governor is going to wait for a vaccine rather than take any actions which might seem to be unpopular. The net result of that decision is going to be a lot of people in the hospital and a lot of people that go to their grave. It is really the wrong decision to take. We need a bridge of public health control of this pandemic in this very critical time. It's a bridge which isn't going to be necessarily a long bridge, 2-3 months, but we must put in stronger public health measures, which include massive testing. One of the things that's been a big failure in the United States is cheap, available testing that everybody can do for themselves at home to know whether or not they're contagious, to know whether or not they should stay home with their families. And we don't make it possible for people to stay home because we don't pay them to stay home. There are things we can do now. I recently urged the Congress, both the House and the Senate, to pass legislation to use the power of the federal government to do this in a veto-proof way in case this president decides to veto what is necessary to save lives between now and the late spring when most people should have the vaccine available to them. We need a bridge to save lives.
Dr. Hazeltine, great talking to you always. Thank you so much for your time, sir. Appreciate it. By the way, he mentioned Florida. We're going to be talking a little bit later to the mayor of Miami Beach, so we've got a lot more ahead. But also, we'll be talking about that potential bribery scheme at the highest level of government. New reporting about an investigation into an alleged offer for a presidential pardon. Plus, Attorney General...
So let me make this point that many people of color are reluctant to take the drug because of the Tuskegee experiments. So you can look that up. And yes, this doctor is right, needing that bridge of public health policy that will help eliminate the virus. And today is December 2nd, 2020.